Today we are going to talk about the Robbins classification of 7 levels of cervical lymph nodes. In previous lecture, we have discussed about the cervical lymph nodes placement according to the traditional classification. What I really mean that in previous lecture we have already done traditional classification of cervical lymph nodes, right? Today we will talk about Robbins 7 levels of cervical lymph node classification, right? Now, this classification is modern classification. It is getting very popular and it has lot of advantages. I will tell you later why specialists, anatomists, clinicians, especially surgeons, radiologists, and oncologists, they prefer to use this classification of cervical lymph nodes. Now, before really I delve into detail of this classification, you must know certain important landmark, right, which will divide these different groups, right? Now, first landmark which you should know is that is base of the skull. Now, of course, you cannot see or observe the base of skull, but if you look at the external acoustic meatus, right, and draw an imaginary line between the two external acoustic meatus, right, that is actually defining, almost defining the base of the skull, right? So from here, right, this classification, we will go down. Now the landmark which are very important to know, right, I will draw it here, that this is your external acoustic meatus, right, and here is your beautiful ear. I don't know I'm making them beautiful or not, but I will love to put some ornaments here. I respect to ladies' ear. Now, this line is defining the base of the skull. This is first landmark you must know before you go into this classification. Second landmark is that when you come down, right, from here, the next landmark is hyoid bone, right? So look at here that this is your baseline, right? This is the baseline or base of the skull, and here it is your hyoid bone. So this hyoid bone I will simply draw over here. This is hyoid bone, you know, it has greater coronal, and so this is hyoid bone. This is our second landmark which we will discuss in detail, right? And then third landmark is, okay, hyoid bone landmark is inferior edge of hyoid bone. Now the next is cricoid cartilage. Cricoid cartilage is shown here in this diagram, right? And this is just below the laryngeal cartilage, and there's a membrane between the laryngeal cartilage and cricoid cartilage. Now, this cricoid cartilage, I will draw it here, right? Let's suppose it's here, right? And I'm not drawing the three-dimensional structure. I'm just placing its interior aspect, and this is our inferior aspect of cricoid cartilage. That makes third anatomical landmark, this one. It means here you have first landmark, which is base of the skull. This is the second landmark before we start classification. That is inferior border of the hyoid bone. Very good. And then third landmark which I wanted to put in your mind, that was inferior border of cricoid cartilage. And the last landmark which is important here is, this is the suprasternal notch, and where clavicles are meeting, right? So I will draw it here, right? Now these are the basic 4 landmarks which you should be very aware of it. Now, once I have explained it, let's identify these landmarks on these three diagrams, right? Because later on I will place the lymph nodes according to the Robbins classification levels. Now, in the first diagram we have already discussed, this is what? Base of skull. What is this landmark? Inferior border of hyoid bone. What is this landmark?
Inferior border of cartilage.
Very good, inferior border of cricoid cartilage. And here is sternomanubrium, suprasternal notch and clavicle. But this is lateral aspect. Here we can see that, okay, here is the ear, upper part I'm making and lower part is coming here. Now, what is this indicating? This level is indicating base of skull, right? And here what it is indicating? Inferior border of hyoid bone. And what is it here? Inferior border of cricoid bone. And this is sternomanubrial angle and their level. Now, the difference in this diagram and that diagram is that here it is superficial dissection, here deep dissection, because you can see internal jugular vein here, which is extremely important landmark also, which we will discuss later. In this superficial dissection, you can see that from here, middle acoustic meatus, this line is going basically what? Base of the skull. What is this? Inferior border of hyoid, inferior border of cricoid and suprasternal notch and clavicle. Now, once we have learned this, right, vertically, another important, very important landmark which we should know vertically running, that is internal jugular veins, right? Because many lymph nodes and levels are along this. So, I will make a very simple diagram. This diagram is, so this is internal jugular vein, okay? This is internal jugular vein here, and you can actually identify that in these diagrams also internal jugular vein. And you know, internal jugular vein at the top, at the base of the skull, it is ending up into what? It is in jugular fossa, right? Of the related with the jugular foramen, where sigmoid sinus, intracranial sigmoid sinus drains into internal jugular vein, right? So internal jugular vein is there, vertical in this diagram. Here only right side internal jugular vein is shown, and it is of course being crossed by the sternocleidomastoid. And here I have not shown the deep. Now we come to the groups, right? First I will just make the groups, right, and levels. After that I will go to their clinical significance, right? First of all, start from here, chin, right? Just under the chin, there's a triangle. You know, neck is divided into many triangles. We will have a separate lecture on that. But here, the muscle, this is digastric muscle. What is this muscle? Digastric muscle. Now, if I draw this digastric muscle, which is already drawn here, right? These are interior bellies of digastric muscles. These are posterior bellies of digastric muscles. Now, between the right and left anterior bellies of digastric muscle, right, and below hyoid bone, there is a triangle here, right? And this triangle, right, I will just draw it here, that digastric anterior belly on one side, this one I have drawn, and other digastric belly here. And what is the bone down? Hyoid bone. This is hyoid bone. Now, in between this, there's this is making an anatomical triangle, right? In this anatomical triangle, in this area, right? Interior belly of digastric from here coming to the hyoid, and apex of the triangle is made the point where interior bellies are meeting each other, and base is made by the hyoid bone. Within this triangle, lymph nodes are found, right? And these lymph nodes which are present over here, these are called submental lymph node. What are these lymph nodes? Submental lymph node. Now, a very important clinical significance is that cancers from the oral cavity, right? They mainly give metastasis in this area to submental lymph nodes. And this submental lymph nodes, right, in Robbins classification, this is called level 1A. What is it called? Level 1A. So we will say, I will put it here, level 1A. Okay, let me put into black, level 1A, right? And lateral to this, if we move lateral, what we see that there, what is this? Posterior belly of digastric, right? Posterior belly of digastric, and this is posterior belly of digastric, and here is anterior belly of digastric, and here is base of the mandible, base of the mandible. This makes another triangle. I will draw it here to isolate it and make it more clear. This is posterior belly of what? Digastric. And let's suppose here is your jawline, right? Now, this was submental triangle, right, which was in between the two anterior belly of digastric. Anterior belly of digastric is very happy because it is contributing to not only this triangle but another triangle. Now, this is unpaired triangle. Unpaired triangle means there is no right or left, we can say submental triangle, there is only one submental triangle. But when we come to the side, in between the anterior belly of the digastric and posterior belly of the digastric, and above what is this? Base of mandible. There is another triangle, anatomical triangle, right? And this anatomical triangle also has very important structures. Especially I should mention here that here is submandibular gland. Okay, which color I should show you here? Submandibular gland. Okay, I will make it green. Submandibular gland is here and here. Now, right now I'm not concentrating on submandibular gland. What I really want to highlight in your mind that there are group of lymph nodes which are present in this triangle. And this triangle is called submandibular triangle. What is it called? Submandibular triangle, because it is just under the mandible. Of course, submental is also under the mandible, but actually its base is made by hyoid bone, submental. And these lateral triangles, which are also called submandibular triangles, their base is made by the base of the mandible, right? Now, submandibular triangle lymph nodes, these lymph nodes are according to Robbins levels of lymph node classification, this is given 1B. What is the name it is given? 1B. So we can say, we can repeat here that in submental triangle there's level, which level of lymph nodes? 1A. And submandibular you have 1B. So basically level 1 is this area. So this area is level 1 triangles, right? Now level 1 for the lymph nodes. And so if someone asks you that in Robbins classification of cervical lymph node, which lymph nodes are included in level 1, you will say submental lymph node and submandibular. But more medially, for example, if you have cancer God forbid, you don't have it. If someone has it, if cancer is from the central part of the lip or tip of the tongue, it will be draining here in its metastasis. But generally speaking, we say that cancer which are from the, what is this, floor, oral cavity, especially floor of mouth, oral cavity, especially cancer which take origin from the floor of the mouth, which might include the anterior two-thirds of the tongue cancer or the other cancers also, they basically drain on level 1A and also 1B. So level 1, whenever you think of level 1, if they are enlarged and they are tender, don't think of cancer. More chances it will be infection. But if there are lymph node enlarged here and they are firm and they are fixed and they are non-tender, you have to rule out cancer in the floor of mouth or floor of oral cavity. Cancer should not be there. Now, we have discussed only level 1. Level 1A, this is level 1 B, right? Now we come to level 2. I will discuss level 2, 3 and 4 together. How? Basically, level 2, 3 and 4. These lymph nodes at level 2 or level 3 or level 4, they are along the internal jugular vein. Now you know, in the neck, internal jugular vein is present within the carotid sheath, right? Carotid sheath has carotid artery and also internal jugular vein and some important nerves, right? Now, right now we are focusing on internal jugular vein, right? Now, those lymph nodes which are present along the upper one-third of internal jugular vein, upper one-third of internal jugular vein, this is upper one-third, this is middle one-third of internal jugular vein, this is lower one-third of internal jugular vein, middle and lower. But with anatomical landmarks, we will say upper one-third of the internal jugular vein is from base of the skull up to the hyoid bone, inferior border of hyoid bone. Middle one-third is approximately inferior border of the hyoid bone up to the inferior border of cricoid bone, cricoid cartilage. And lower one-third is from the lower border of cricoid cartilage up to the clavicles and manubrium, right? Now, we have done these 3 levels here. Now, lymph nodes, cervical lymph nodes, and these are deep cervical lymph nodes. They are also called jugular lymph nodes. Here they are called upper jugular, middle jugular, lower jugular. But when we talk about Robbins classification, then we divide it into 3 levels, right? Now, lymph nodes which are along the, what is this? Upper part of internal jugular vein, these lymph nodes, right, are called this group of lymph node which are around that upper third of the internal jugular vein, which is anatomically identified from base of the skull, right? Of course, you from this, and when you are doing dissection, you will get it up to jugular foramen if you go to that deep dissection. So lymph nodes along cervical lymph nodes, rather deep cervical lymph nodes along the internal upper one-third of the internal jugular vein, these lymph node group are called level 2. We have already discussed, here was level 1A, here level 1A, here it was level 1B. Now we go to internal jugular vein. Now in upper part of internal jugular vein here, there is level 2. So here actually you will have level 2 nodes, right? Some medial, some lateral, some anterior, some posterior. to the internal jugular vein, right? So this is which one? Level 2. These are level 2. So I will put it here, level 2. Now there is something very interesting. If I make a cross section here, and draw that cross section, okay, I'm making this cross section here, and I draw this cross section over here, right? If this is internal jugular vein, right? Now, these are anteromedial nodes, because these nodes are interior to and medial to this, right? Some of these nodes are interior, some are medial. Then there is other group which is posterior and lateral to it. So this is posterolateral group, right? Usually accessory nerve anatomical course has a lot of variation, but usually it is crossing around this area superficially, right? Spinal accessory nerve. Now, in level 2, lymph nodes which are anterolateral to the jugular vein, right? At level 2, those subgroup of lymph nodes which are anteromedial to the jugular vein or anteromedial to the cervical, so spinal accessory nerve, these are basically called, divided into level 2A. This is level 2A. Level 2A, right? And these which are posterolateral to the internal jugular, in upper 1/3 of the internal jugular vein, this is called level 2B. These are called level 2B. Now, this is very clear. If you cannot remember A and B separately, there is no problem. Even if you just remember that part of the internal jugular vein which extends from the base of the skull up to the inferior border of the hyoid bone, which is usually upper 1/3 of the jugular vein, deep cervical nodes along that vein are actually Robbins classification level 2. What is this? Level 2. Now, out of this, one lymph node is very important. Okay, I make it here. One lymph node is very important. It is usually in bigger size, right? And it is given a very special name. Name of one of these lymph node has special name, that is jugulodigastric. What is the name of this? This jugulodigastric lymph node, which is one of the member of deep cervical lymph nodes at level 2, right? Why I am highlighting it? Because every doctor must know that this is the main lymph node which drains palatine tonsils. And because palatine tonsils very commonly get infected, so due to repeated infections and follicular reactions and fibrosis, as compared to all cervical nodes, usually it is the largest. Usually it is even largest, even physiologically, right? This is jugulodigastric node, which is part of the 2A level, right? One more thing which I want to highlight, as I highlighted that in group 1A and 1B, there were cancers and infections from where? Floor of the oral cavity or floor of the mouth were draining here. So now, what is draining in level 2? I'm more interested that you must be able to tell me the areas from where the primary cancer take origin, and most probably they are giving their metastasis to, what is this? Level 2 lymph nodes, right? So here I should draw one more diagram. and that diagram, because I have to show the catchment area, draining area, right? So let me make it here. You have a nose, I hope. Upper lip, lower lip, tongue, palate, your eyes without mascara, anterior cranial fossa. This is, what is this? Nasopharynx. Because this tube which is going from here, it is pharynx. Now the part of the pharynx which is behind the nose, this is nasopharynx. So this is nasopharynx, right? I should draw it rather with dotted lines. This area is nasopharynx. Now, this area which is behind the oral cavity, this is called oropharynx, nasopharynx, oropharynx, and then of course here lies your voice box, larynx, which produces a lot of trouble in your life if you use it indiscriminately, right? And this is larynx, and here is your cricoid cartilage, and here your trachea, right? And here is, behind it is going your esophagus, right? This is from here, esophagus. Pharynx is draining into esophagus. What I really want to highlight, this part of the pharynx which is behind the larynx, this is called laryngopharynx, or this is called hypopharynx. Hypopharynx. Now what I really wanted to highlight, first of all, before I go detail in the drainage of the lymphatics, that our pharynx extend from the back of the nose to the back of the oral cavity to the back of the larynx. Uppermost back of the nose is called nasopharynx, back of the oral cavity is called oropharynx, back of the larynx is called hypopharynx or laryngopharynx. Now, once you have understood this thing, cancers which take origin from nasopharynx and oropharynx, these two drain at level 2. Their metastasis most frequently come to level 2, right? So now you can see here that cancers which were taking origin from floor of, what was this? They were coming to level 1A and 1B, right? But cancer which is coming from here, these two love to come to level 2. So these lymph nodes, these are receiving lymph drainage, and along with that, God forbid, if there is cancer, so metastasis will be coming here from nasopharynx and oropharynx, right? And these are the most important drainage area. There are others, but I will not go into detail, right? Because right now I'm focusing on how to explain you to the levels and the clinical relevance. Now, in this diagram, if we see, if I ask you in this part of the lymph nodes, from where the cancers are coming? Nasopharynx, oropharynx. And if I ask you that in this diagram, okay, here also we can make above the hyoid bone, right? These lymph nodes are level 2. Level 2, of course, they are on both sides, and which were anteromedial were level 2A, which were posterolateral, they were level 2B, right? But if you cannot remember them separately, there is no issue. But what I want you to remember, that these lymph nodes, if they are hard, firm, non-tender and fixed, think of some unfortunate situation, that is a cancer draining from or around the area of nasopharynx and oropharynx. Is that right? And if you have just one lymph node which is enlarged and tender, right, might be this is a palatine tonsillitis. Okay. Right. That is jugulodigastric lymph node. Yes. So now we are very clear about level 1A, level 1B, cancer of oral cavity, floor especially. Then level 2, which is extending from the base of the skull up to the inferior border of the hyoid bone, and some are anteromedial group, which is called 2A, some are posterolateral group, which is called level 2B, and these levels are catchment area for the lymphatics from the oropharynx and nasopharynx. And if there is infection or cancer from there, that will make these lymph nodes involved, right? Now we go down. We have done 2 levels. Now third level. Third level, first I will explain here, then I will come there. I have not done the second lymph nodes here. So these are the lymph nodes which are basically 2A group in this diagram, right? In this diagram, if you look, 2A, because internal jugular vein is under that, so they will be deeper to this, right? Now, come back. We have done the one, right? And just to show here is internal jugular vein, and this was going up to the jugular fossa, and lymph nodes here were, what was the group, please? Lymph node level 2, right? A and B, level 2 lymph nodes A and B, nasopharynx, oropharynx, drainage area. Now we come to the level 3. Level 3 is basically this one, right? It extends from the hyoid bone inferior border up to the cricoid cartilage inferior border. So you can say this level, right? This level. This is level 3 of Robbins classification of cervical lymph node, level 3, right? Now, these lymph nodes, thanks God, anatomist or our senior doctors have not divided into subgroups, or if they have divided it, they are not expecting us that they should be in the scope of this lecture. Now, this is group level 3. Now, these level 3 lymph nodes, what they are draining, come back here, right? Because here is internal jugular vein, right? And they were going into level 2. Now, level 3. Level 3 basically, yes, you will tell me? Hypopharynx and larynx. Very good. Excellent. Of course, these area. Hypopharynx and larynx. Jugulo-omohyoid I will explain. Jugulo-omohyoid I will explain. Now listen. This is basically lower area which is hypopharynx and larynx, but this third area mainly receiving hypopharynx and from larynx, right? And some from oropharynx. Some from oropharynx, right? Now, here there is one very important lymph node which every doctor should know, and here I am making these lymph nodes. What are these lymph nodes? Robbins classification level 3, which are along the middle 1/3 of internal jugular vein and anatomical landmark present between the lower border of the hyoid and lower border of the cricoid. These are mainly draining which areas? Hypopharynx and larynx, right? And some lymph node from oropharynx. So infections and more importantly, cancers can come here, right? Out of these lymph nodes, one lymph node is very important, that is jugulo omohyoid lymph node. Jugulo omohyoid lymph node. Jugulo omohyoid lymph node. That is one of the lymph node which first of all enlarges when metastasis or infections come here, right? So in level 2A, with the upper jugular, you must remember one specific, in level 2, you must remember jugulodigastric, draining the palatine tonsils. And when you come to the level 3, right, this level 3, you must remember jugulo omohyoid lymph node, which is very important clinically because it is first to receive the cancer metastasis from draining area like hypopharynx and larynx and maybe lower part of oropharynx, right? Now, you know why these levels are so important? Because if we know the cancer, we know which lymph node to study, which lymph node to dissect, which lymph node to remove, right? So actually, if you know these levels, this gives you option to do a very selective, to the point dissection and surgery, and that reduces morbidity for the patient and reduces unnecessary, you can say, surgery in the neck. That is why especially oncologist, radiologist, pathologist, anatomist, they love this modern classification because this will guide the surgeons to remove not a big area of the neck nodes, rather specifically those nodes which are draining a specific primary cancer. Because this gives us knowledge that if cancer is in oral cavity, which nodes are most probably to be involved, right? If it is in nasopharynx, which nodes are supposed to be dissected and studied, right? Let's come forward. We have done level 1. What was this? Level 1A. Which triangle? Submental triangle, unpaired triangle, single triangle. Then 1B, submandibular triangle. Both of them, this is paired triangle, both of them drain from the floor of mouth, right? Oral cavity. Then we came to, what is this? Level 2, which was upper 1/3 of internal jugular vein. Then level 3, which was middle 1/3 of the internal jugular vein. But I will prefer that you guys always mention anatomical landmarks too. Now we are left with the lymph nodes, deep cervical jugular lymph nodes, which are along the lower 1/3 of the, what is this? Internal jugular vein, which basically these lymph nodes are basically extending from the lower border of cricoid cartilage level up to the clavicle or sternoclavicular suprasternal notch. Now, I can show them here in separate diagram. Now, these are next level, and next level is there was level 1, A, B, 1B, 2A, 2B, 3. Okay, I will write it here, 2. Here it is 3. And what will be this now? 4. Of course 4. I know your counting is good. 4. Now this level 4 lymph nodes, actually what are these? These are basically lower jugular veins, right? And in landmark, they are between, upper limit is inferior border of cricoid and lower limit is clavicle then suprasternal notch, right? Now these lymph nodes, they are very, very troublesome, because if these lymph nodes are involved, usually disease is advanced, and especially I will explain later, some lateral lymph nodes are involved. Lateral to these, they come into another level. They also indicate some serious spread. But let's come here. What drains here? It's very easy to look. What is draining to this part? If we are talking about these lymph nodes, now here I'm making black color level. Yes, please. 1, 2, 3, and this is level 4, right? And of course here also, from here to here, they are level 4. Now, what is draining here? It's very clear here. This is thyroid and hypopharynx. But if I go to, of course, they will come to this, right? Especially papillary carcinoma. I will go to that carcinoma later, but first I want to make it here, that here is your thyroid butterfly. Thyroid gland, only I am showing this half. So if here are the level 4. Now look, level 2 was mainly with upper 2 part of the pharynx, upper 2 part of the pharynx. Level 3 was lowermost part of pharynx and larynx. And this area is hypopharynx coming from here. It drains downward also. Hypopharynx, and what is this? Thyroid. Right? So let's do it here. Submental and submandibular, level 1A, level 1B. Drains, floor of the mouth, oral cavity, cancers. Okay, let's focus only on cancer, but it is understood catchment area and also understood that infections will also come there. After the A, level 2. Level 2 is extending from base of the skull up to the hyoid bone lower level. These are having which cancer can come? Nasopharynx and naropharynx and oropharynx, right? And important lymph node to remember here is jugular-digastric lymph node, which loves to drain your beautiful palatine tonsils. Then below the hyoid bone and upper lower border of the cricoid, which was middle third of the internal jugular vein, right? This was draining the lymph node. This was level 3, right? And it was draining basically larynx and hypopharynx, right? And sometimes lower part of hypopharynx. Then oropharynx, right? Then we can go down the lowermost area along the internal jugular vein, which extends from lower border of cricoid cartilage to the clavicle. This is level 4, and this drains mainly cancers from the thyroid and from hypopharynx, right? Now, even these lymph nodes can drain from cervical. If extended, there is too much extension from central group, which I will discuss later, to extended spread, then tracheal carcinoma, cervical tracheal, and cervical esophagus. But practical purposes, at your level, at student level, it's more than enough to remember that thyroid gland is draining here. Now here I want to mention something. Some of the thyroid glands prefer to spread initially through lymphatics, and the other thyroid cancers which preferably initially like to spread hematogenously. Now, thyroid cancers, especially papillary cancers, which are 80 to 85% of the cancers, they initially love to spread to the lymph node. I will tell you later that they spread initially to the central lymph node, and eventually they can come to levels 4 and 3 sometimes, right? Now, papillary carcinoma, but follicular carcinoma prefers initially to spread through hematogenous. Then medullary carcinoma, which is carcinoma because papillary carcinoma and follicular carcinoma are from the malignancy derived from the follicular cells of the thyroid. But there are parafollicular cells of the thyroid which make calcitonin. If they get malignant, we get medullary carcinoma. Medullary carcinoma behaves in a double way. It loves to go to the lymph nodes and also spread hematogenously distantly, right? Of course, hematogenous spread mean spread to the bones and to the liver and to the brain and some other areas. Lungs, of course, lungs should be mentioned first of all. Now, so we have done level 2, level 3, level 4, right? After we have learned this, now we go to the level 5. There's already very beautiful diagram here for level 5. Level 5 lymph nodes are deep cervical lymph nodes which are present in the posterior triangle of the neck. Now, posterior triangle of the neck is basically this one. This is made by the posterior border of sternocleidomastoid, anterior border of trapezius, and upper border of clavicle, right? So we can say that this is which muscle? Sternocleidomastoid. What is this muscle? Trapezius, right? Trapezius. And what is under it here? Clavicle. And which triangle is here? Posterior triangle of the neck, right? Now, the lymph nodes which are present in the posterior triangle of the neck as a group, they are called level 5. Of course, you exclude the level 4 from here which are along the internal jugular vein. So, I will say here are level 5. But upper part of this is 5A. I will tell you exactly what are anatomical differences. And lower part is 5B, right? Now, it means if lymph nodes are here, this is 5A. And if lymph nodes are here, right, here or here, these are 5B. This is omohyoid, right? Here I just want to mention, omohyoid divides the posterior triangle into bigger upper and smaller lower triangle. This upper triangle is occipital triangle and this lower triangle is supraclavicular triangle. But for our level 5 discussion, omohyoid is not important, right? When we are talking about level 5, we say upper part as level 5A, right? And lower part is having level 5B. What is the real difference? Difference is, number one, this accessory nerve, spinal accessory nerve. The lymph nodes which are above the spinal accessory nerve which crosses the posterior triangle, right? The lymph node above, they are considered 5A. And lymph nodes which are below, they are considered 5B. Another way to, because of course accessory nerve is not visible, that is only when you are doing dissection of the neck, deep dissection or surgery. But if you want to know lymph node enlarged in the posterior triangle, is it A or B, the ideal thing is, don't forget your level of cricoid cartilage. Lower part of the cricoid cartilage, this is here, cricoid cartilage, right? And this cricoid cartilage, lower level goes like that. Lymph node, if we extend imaginary, in our imagination, cricoid cartilage laterally, it will divide the posterior triangle into upper and lower part. Lymph nodes above that, 5A, lymph nodes below that, 5B. This is anatomical landmark, and during dissection, spinal accessory nerve can also help to divide the 5A and 5B. Now, catchment area, 5A. 5A is taking, this is very bad, you know. This is something like me, but they put the lipstick. Anyway, now I cannot do anything except that I keep on teaching with a sad heart. I don't want lipstick. Okay, so, but it does not mean that my lips can never have lipsticks. Others' lipsticks can be there also. but we should not discuss such things in the lecture, right? So you also don't tell this someone. Okay, now what we are saying that scalp, cancers from the scalp, especially melanoma, squamous cell carcinoma, right? Cancers from the scalp, they love to drain into 5A level. They love to drain into 5. I just want to highlight this 5A. These are upper. This is a 5A group. Now, so what we can say that cancers from these areas, right? They love to converge into upper lymph nodes in posterior triangle, which are level 5A, right? And of course, infections also go there. Remember this classification, Robbins 7 levels of clinical classification of cervical lymph nodes is about the lymph nodes related with the neck. I'm not discussing lymph nodes in head. I'm not talking about pre-auricular or post-auricular or other lymph nodes, right? Just I'm focusing on somehow I explained to the level, these levels. Now, thanks God, we have reached. Now you will tell me the level. 1A, 1B, 2, A and B, 3, 4, 5, 5A, 5B, right? And this 5B, which are lower, right? There are also some authorities include in subclavicular lymph nodes also. Now here I want to tell you, subclavicular lymph node, the lymphatic drainage area on the right side and left side is much different, right? Right side mainly drain on the right arm, right thorax, right, and right side of the head and neck eventually, because these lymph nodes will eventually come down to this area, progressive drainage, because here eventually lymph will enter into at the junction of the subclavian and jugular in the venous blood. Left side is very important. When we talk about these lower lymph node or subclavicular lymph node or 5B lymph nodes on the left side, we should be very serious. Better to take 1 cup of coffee and then talk about it. This is very serious matter, lymph node in this area. Whenever you are doing general physical examination of patient, please put your soft, beautiful fingers here and try to palpate if there is any lymph node enlarged here. Especially, there is a very special type of lymph node here which is called varicose lymph node, right? That varicose lymph node, if it is enlarged, non-tender, firm to hard and fixed, it has a very bad news for your patient. Again I will repeat. Left subclavicular lymph nodes, which are group of the level 5B in the lower part of the posterior triangle, they have a varicose node, right? And if that is enlarged, non-tender, fixed, found to hard, it is a very bad sign. The sign is called Trizier sign, but I cannot remember Trizier sign clearly. I always say trouser sign, but you don't say in exam trouser sign, right? Then others can ask you about some other signs which are not trouser sign. So remember Trizier sign. Now Trizier sign, now why this is so important? Because it drains a big part of the body, because thoracic duct is coming near this area and joining the big part of lymphatic drainage to the junction of internal jugular vein and left subclavian vein, right? So this area drainage every doctor, medical student should know. That is both legs, of course pelvis, I will not say both pelvis, but pelvis, whole abdomen, left thorax and left part of head and neck. All the lymph which is connected from these regions First they go to the regional lymph node, then progressively they keep on draining into bigger lymphatic system, then they drain into thoracic duct, and thoracic duct which has a lymph from, if I catch here thoracic duct here, that will be bringing lymph node from both legs. You have two legs, both legs, pelvis and associated organs, and abdomen, and left thorax and left head and neck. And so much high lymph flow is from here adding to the venous system at the junction of subclavian and internal jugular vein, right? Now, this varicose node is connected through some lymphatics with this thoracic duct. If there is some cancer in these catchment areas, their metastasis can be regurgitated into varicose lymph node also. And if they go to the varicose lymph node, it means that cancer is already very much spread. For example, if there is testicular cancer and patient has one testis enlarged and he has varicose lymph node, so very bad news. It means that all the area between the testes up to varicose lymphatic system has been involved, and maybe hematogenous spread is there. But there are many cancers which make this node cancer don't make varicose node. Cancer make varicose node into trouser sign, not trouser sign, trouser sign. See the spelling from Google. What I really want to say, if someone asks you, just tell one single cancer you will think of if varicose lymph node is enlarged, fixed, tender, right? Gold standard answer is gastric carcinoma. Gold standard answer is gastric carcinoma. But actually, in such patients, you have to do lot of work, investigative work, because cancer from the legs, from pelvis, ovarian cancers, testicular cancers, uterine cancers, even renal cancers, bladder cancers, hepatobiliary cancers, colorectal cancers, and of course you will not forget stomach cancer, then left side of the lung cancer, and esophageal cancers, and even cancer from the left side of the head and neck, which are very advanced, will make the appearance of pathological varicose node, right? So if you don't remember anything out of this lecture, please remember this varicose lymph node in its pathological form and doing the investigative work. You will save some lives in your life, okay? But this is part of subclavicular group of lymph nodes, which is itself part of level 5B. Is that right? Now, we have done 5 levels. And after the 5, we must come to which level? 6. Very good. Your pronunciation is right. Level 6. Level 6 is easy to explain. Level 6 is between, I'm going to draw here, from lower border of what is this? Hyoid bone. From lower border of the hyoid bone, below the lower border of hyoid bone, above the suprasternal notch, and in between the carotid sheaths, or medially to the carotid arteries, because in carotid sheath, carotid arteries are more medial to the internal jugular vein. So we can say, what is this here? Hyoid bone. What is this here? Right? And what is here? Carotid arteries. Now, in between all this, all the lymph nodes which are present in this area, they are called level 6. 6 means not SEX, it is SIX, right? 6 lymph nodes. It does not mean there are 6 lymph nodes. This is 6th level of the lymph nodes. Lymph node, there are more than 6. This is 6th level of lymph node, cervical lymph node classification of Robbins system. Actually, because they are in the center, this is hyoid, this is sternocleidomastoid joint, and it is from here to here, right? Carotid arteries, medial to carotid arteries, below the hyoid bone, above the sternocleidomastoid joint. Now this area, because it is center of the neck, these lymph nodes are classically also called central cervical lymph node. So we can call this group of lymph nodes central cervical lymph node. We can also call them central compartment of the cervical lymph node, and according to the level we can call it level 6 lymph node. Now which lymph nodes are included here? Here the lymph nodes which are included, number 1, which is very important, which is just above the thyroid gland or in front of cricothyroid membrane, right? Let me make it here. This is hyoid bone, under it there should be larynx, below the larynx there should be thyroid. So if I make thyroid here, right, then under the cricoid, this is cricoid, there should be thyroid. It's not as beautiful as you are, but still little asymmetry. Oh, I don't know it is thyroid or which gland, but you suppose this is thyroid gland. Now, here is cricothyroid membrane. Here there is a lymph node. This is, I will make it red because this is also very important, right? There was jugulodigastric, very important, right, which was part of the level 2A. Jugulo-omohyoid, very important, which was part of
level
3. And there was, yes, left side varicose lymph node. I can show it here. Varicose lymph node, which was part of the level 5B, because if we can do like that. So here is level 4 and here is 5B, right? Okay. Now, don't confuse this diagram with this diagram. This is your, what is this? Carotid artery, right? Carotid system we should say, because as it goes up, it divides into external and internal. Now, this is level 6. In this number 1, which is here, what is this? It is called pre-laryngeal lymph node, and it is also called pre-cricothyroid lymph node, and it is also called Delphian lymph node. There are 3 names for this lymph node, right? Pre-laryngeal lymph node, or pre-cricothyroid lymph node, or Delphian lymph node. This lymph node is very important. Why it is so important? Because it is the primary and first drainage of from thyroid cancers and from lower part of the larynx, right? And especially for surgeons, which is extremely important, radiologists, which is extremely important, because they will take the sample of this lymph node, not really sample, they will do fine needle aspiration or biopsy, whatever they think appropriate, and they will look for, are there metastatic cells here or not. These metastatic cells or cancer cells may be derived from thyroid or from the lower larynx. To be very exact, in the larynx there are vocal cord. Lymph node below the vocal cords are drained downward. Lymph nodes above the vocal cords, lymphatics below the vocal cords are drained downward, and lymphatics above the vocal cord are drained upward. So we say that Delphian lymph node will receive subvocal cord or subglottic lymphatic and thyroid lymphatic. So cancer from these areas will produce metastasis here. So this is Delphian lymph node. In this diagram, Delphian lymph node should be somewhere here, right? Then there is a very important group of lymph node which is just in front of trachea. Trachea is here, this is hugging the trachea. If I make a diagram here, thyroid gland, isthmus, one pole, second pole, this is cross section, right? And this is vertical and this is cross section. Actually, here is your trachea going. What is going? Trachea, and behind it there is going esophagus. Esophagus. And in between the groove of the esophagus, there is extremely important nerve, recurrent laryngeal nerve going upward. What is this nerve? Recurrent laryngeal nerve going upward, right? Now, this recurrent laryngeal nerve is not only here, it is going to the larynx, which is just above the trachea. But actually, if there was space here, I will make trachea here also. Okay, come here. This is the trachea. Behind it there is esophagus, and laterally there is a groove between trachea and esophagus on both sides. In that groove, the nerve which is going up is right and left recurrent laryngeal nerve. That is why it is important, you will see very soon. Here, okay, I am making it red. These are pretracheal lymph nodes. What are these? Pretracheal lymph nodes. So we have prepharyngeal laryngeal lymph node, we have pretracheal lymph node, and then there are paratracheal lymph node. What are these? Paratracheal lymph node on the sides of the trachea. And then some of the paratracheal lymph node extend backward. They extend backward, right? And okay, I will draw this diagram from lower level. That thyroid gland, isthmus, and here is upper pole, and this is cross section. Now this is lower part of the thyroid. Here will be, what will be here? Trachea. Very good. What will be just behind it? Esophagus. I'm just enlarging it. Anatomically it is not wider than this, but this is esophagus, which is vertically, and trachea is here and esophagus is here. Now, lymph nodes, there are what was this? Which was also called Delphian lymph node. Very important sentinel lymph node. For sentinel lymph node is that lymph node which is part of the regional lymph node which drains first incoming lymphatics, and sentinel lymph nodes are not very sentimental, but we are very sentimental about them because if we are suspecting cancer, at least we have to take a sample from the sentinel lymph node. So for thyroid cancers and for lower part of larynx cancer, Delphian lymph node is what? Very important, it is sentinel lymph node. We were discussing the central lymph node. So one I mentioned, what is this? Prelaryngeal, or Delphian. Then there are pretracheal, right? In lower part I will show here pretracheal. Then there are paratracheal on the side. These are paratracheal. The point which I wanted to highlight, that if you look from the side, you see here, what is this? Trachea. If in this diagram, if we see, what is this lymph node? Delphian. What is this lymph node? Pretracheal, and front of the trachea, because it's side view. What is this? Paratracheal. But some of the paratracheal are between the groove, between the esophagus and trachea. And in this groove, which nerve is going up? Recurrent laryngeal nerve. So, if someone has unfortunately going under thyroid surgery for any reason, including cancer, due to cancer or due to some other reason, if someone is going under thyroid surgery, surgeons are very careful when they go for parathyroid lymph nodes, because recurrent laryngeal nerve is passing through that, and they want to preserve the structure and function of the recurrent laryngeal nerve, which is supplying almost all intrinsic muscles of the larynx, right? And they control major function of the vocal cord. And if recurrent laryngeal nerve is damaged, then patient will, if one recurrent laryngeal nerve is damaged, patient will have hoarseness of the voice. It does not mean that his voice will be running on the horse. Hoarseness voices mean that vocal cords are not properly approximating, and I don't know how to make a hoarseness of voice or horse-like voice. You will see it on YouTube. Write down hoarseness of voice and see what comes. But for my duty right now is that I should tell you when you are doing thyroid surgery or paratracheal surgery or paraesophageal surgery in the cervical region, or you are dealing with the paratracheal lymph nodes, please never forget recurrent laryngeal nerve. Even if you have before doing surgery in the morning you had problem with your wife, still you don't forget recurrent laryngeal surgery, because that recurrent laryngeal, if one side is damaged, a patient will get hoarseness of voice, and God forbid, and of course with that some respiratory problem, and God forbid, if you are doing the total thyroidectomy, and if that day was your bad day as a surgeon and somehow you got very clumsy and damaged both recurrent laryngeal nerve, there's a matter of life and death. Forget about hoarseness of voice. There's something big problem, because when vocal cords get paralyzed, they get paralyzed in median position. It's a wrong concept that vocal cords, when their muscles paralyze, vocal cords fall apart. No, they get paralyzed in median position, and if they are paralyzed in median position, person cannot breathe if both recurrent laryngeal are damaged, and then you have to do emergency tracheostomy to provide the airway, emergency airway. But what I wanted to tell you, that here are your central lymph node, which include, what is this? Delphian lymph node or pre-laryngeal lymph node, pre-tracheal lymph node, paratracheal lymph node, and some lymph nodes are scattered around the thyroid. We just call them perithyroidal lymph node. Now, this whole group of lymph node, pre-laryngeal, pre-tracheal, parathyroidal, and paratracheal and perithyroidal, whole this lymph node group is called, number one, central cervical lymph node, and they are included in level 6. They are included in level 6. After the level 6, then we come to the last level, which is level 7. Level 7, right? That is basically lymph nodes included in or placed in superior mediastinum. Superior mediastinum means that it is posterior to the, what is this? Manubrium. Upper level is, no, suprasternal, more accurately, upper level of superior mediastinum is thoracic inlet. Lower level is angle of Lewis. Back is T4 and T5. Let me draw it here, that here is manubrium, right? Upper border of manubrium, angle of Lewis, and on the back, which vertebra?
T4 and T5.
T4 and T5. And above is what? Thoracic inlet. Above is thoracic inlet, and below is where there is angle of Lewis crossing, and it usually contains, definitely contains main arteries like arch of aorta and its branches, and main venous drainage system, and also through this is esophagus and trachea passing. Around all these structures, lymph nodes are scattered. Those lymph nodes are called superior mediastinal lymph nodes. Let me repeat. Superior mediastinum, interiorly it is bounded by manubrium, posteriorly bounded by 4th and 5th thoracic vertebra, laterally bound by the upper part of pleura on both sides, superiorly limited by the thoracic inlet, inferiorly limited by angle of Lewis. There are many structures here, including fat and nerves and lymph node, but special mentions should always be made about great vessels and trachea and esophagus. And because we are studying lymph nodes, so the group of lymph nodes here is called superior mediastinal lymph nodes. Now, this group is called group 7, group 7 of Robbins, not group 7, level 7. We don't call these groups, we call these levels. Level 7 of lymph node of Robbins classification. It is anatomically or truly it is not part of the neck. But why many authorities classify it with the neck lymph node? Because embryologically these lymph nodes are actually coming from, migrated from upper part of the lower part of the neck down. Secondly, the lot of lymph from neck structures, if it drain beyond many lymph node, this can drain up to superior mediastinal lymph node, especially when we talk very aggressive lymph nodes, very aggressive cancers of the neck, like highly anaplastic cancer of thyroid. So that will not only go to the central lymph node, that will not only spread to the lymph node at level 2 and 3 or 4, they can also go to level 7, right? So when level 7, look here, if level 7, it is here now. If level 7 is involved, okay, we can make level 7 here. This is manobrium here, right? Here are your, okay, vertebral column, right, 4 and 5. And in between these, this is thoracic inlet, here is angle of Lewis, and in between the great vessel, then trachea and esophagus and some fat and lymph nodes and many nerves, right? These lymph nodes, I should make them very sad because this is a sad news for the patient. These lymph nodes, if they are enlarged and if you have thyroid cancer, you should be worried. It should be highly anaplastic thyroid cancer, or it is some follicular cancer which has been ignored for too long time, right? So, I will close the discussion here that these level 7, just very rapidly. 1A, 1B, upper part, 2A, 2B, no, 2A medially, and 2B, then 3, then 4, then 5, 5A, 5B, right? Then 6, and then 7. Now, this classification importance, I will repeat it. This classification has got very popular now with the anatomist, with the surgeons, with the radiologist, and with the oncologist, because this gives a universal language to communicate about in certain involved lymph nodes in between the different subspecialty of doctors, right? If an oncologist is saying that, or radiologist saying that I see the lymph node which are enlarged in level 2, oncologist exactly understand which lymph node he is talking about, right? Second advantage of this is that if you know this and you know the primary cancer, you will do only necessary dissection of the lymph nodes which are most probably involved. So this has given us, you can say, opportunity to that in head and neck cancer, we can do relatively selective surgery and morbidity in patient is reduced and complications are reduced, right? And another important thing related with this is that even in research labs, when they're doing on certain level of lymph nodes, they can communicate very easily that when one doctor means level 1A, everyone understand which lymph node group is being talked about. So, very important for anatomist, pathologist, radiologist, because if a surgeon take a lymph node and send to the, or he take fine needle biopsy, he will send it to the pathologist, he should mental this sample is taken from level 3 lymph node, right? So that pathologist can think of what kind of pathologies I can expect under the microscope, what kind of metastatic cells or cancer cells I can expect, right? So it's This classification has made life easy for the people who are very interested in neck other than surgery. No, who are really interested in pathologies and surgeries. That anatomist, yes, radiologist, pathologist, oncologist, and surgeon, right? Radiologists have two important things about this. They use a little modified Robbins classification. I will not go into that detail, but radiologists have two, because number one, they are diagnostic radiologists, which can tell exactly where the pathological lymph node is present. Second is therapeutic radiologists, which are giving, what is this, radiation to the involved lymph nodes. They know that if they know which level they have to target, they know exactly what should be the field of radiation, right? So now we have finished a very important topic. In previous lecture, I discussed about the traditional classification of cervical lymph node. In this lecture, I discussed the modern classification of cervical lymph node according to Robbins levels of cervical lymph node and their importance. Thank you very much.